It's a slightly very vast topic to be covered in 7 minutes, but we'll try to just to show some photographs here. You know, AVM, as we know, it's a communication between arteries and the vein, and it's a very complex subject. And if you are not doing the AVMs regularly, then you should not venture into this field because there are a lot of things you have to understand. But I'll just try to make it in a simple. This cartoon is very important, and the guy was flying for the first time, and the tower asking, "Can you give me your position? I'm next to the cloud that looks like a lion. Can you be a bit more specific? It's Simba." So, you know, it should not be like that, you know, what you are dealing with in AVMs. So in terms of vascular malformations, it can be converted simple. It could be very slow flow, it could be a high flow. So that's a very big basic difference which we need to understand, which I'll try to show you with the photographs. Then there is an association, this international association, which converts them into different categories, simple, combined, and a lot of syndromes which are there. There are a lot of another clinical system classifications which you must know in terms of grading of severity of the disease. And this is the important classification in terms of treatment, because if you have directly the arteries going into the vein or with multiple branches, the treatment is much simpler as compared to the treatment here where there are multiple branches of the arteries getting connected to multiple branches of the vein. Let's talk about this. Now this is a venous malformation. Okay? As you can see, extensive veins, you take the hand up, the veins all collapse. So this is a slow flow venous malformation and difficult to treat, but we can do at least something for this patient. This is a KTS, which we know, it's also associated with a slow flow venous malformation along with varicose vein. We get a lot of these patients. And imaging is simple, and we can get a lot of information regarding is it a slow and a high flow malformation. But this is another angiogram picture which shows you an arterial phase. The pointer is not working. And a capillary phase in the center where a lot of capillaries are there. And the venous phase at the lower end where you can see a lot of veins which are getting filled. In terms of treatment of venous malformation, we treat it for few indications, but mainly conservative. Maybe in the small ones we can resect, and the rest ones we can do a various sort of ablation techniques. So let's take this example. This guy had 2 surgeries done before. He's an 18 years old boy. AVM, it's a high flow AVM with previous multiple surgeries and very pulsatile mass in the loin, and it's painful. So you do a CT angiogram which shows a huge AVM. I'm not able to show you with this. I'm sorry, the pointer is not working. And multiple arteries are coming from the internal iliac. So once we do, how do we treat that? So what we do is a hybrid approach. What we do is we go from the arterial end and try to block the nidus. Nidus is where the arteries, the capillaries join the veins. And then we block the inflow. And then we go into the venous system and block the outflow. So I'll just explain in simple terms is here. You look into this. I don't know how to explain to you. Sorry. Can you give me the pointer, please? Hello? No. Okay. They're busy. Okay. So you got arteries. So you go from the arterial side and try to block the arteries with the coils and the plugs. And then you go from the venous side and try to block it with the coils from there. Okay. So let's see, look into this. This is, you can see a picture very nicely here, an internal iliac angiogram with multiple arteries going into the component here. And then you got a selected venogram, and then you can look into this. It's not working. Put it on the screen, yeah. So there are multiple branches which are supplying that malformation there. And we go a super selected cannulation. Look into the microcatheter, how far it has gone inside that small thing. And then we release the onyx. So onyx is a slow releasing compound which we can control very well, and and the catheter doesn't block with it if you put it properly. But onyx is expensive. So sorry, somebody is running my videos. Please don't run my presentation. I will run it myself, don't run it. Okay. And so super selective cannulation with onyx, injection with microcatheter, which we did. And you can see the onyx flows slowly, but it's quite deep inside. So you need to reach the nidus if you have to block it. And then you can do a glue and a lipidol. So this is cheap, and you can block a lot of multiple vessels within one shot. And there are tricks how to do this. Then we do a percutaneous angiogram of the venous system, and then we block the vein. There are various ways to do it. And then we can put in a glue injection into the vein and block the outflow. So you block the nidus, you block the inflow, and you block the outflow. So this is what we call a hybrid closure of the AVM. And then we do the check angiogram. You can see a glue cast of the whole AVM over there. And then a week or 2 weeks later, you can surgically excise it. And it's a 2 years follow-up. This patient ended now 4 years follow-up with us, and patient did not have any recurrence. And at 5 years, I will discharge him from our clinic. And you can get an angiogram before and after embolization. Such a picture here. I just wanted to explain to you, but it looks difficult. Coming to the hand, you got a similar thing in the hand, an AVM there. And you can see an AVM on the palm over there. And we go with a microcatheter into the nidus, and we give multiple injections, and you get similar results. Similarly, into the thigh AVM, into the very big on the right side, we go with a microcatheter here and put in a big glue cast, but there is still some vessels down, which we didn't operate it because the patient was totally asymptomatic and he didn't have enough money to be operated again. So we just left him alone because this is enough, because we need to make the patient asymptomatic. Similarly, a scalp vein which is there, and just 4 seconds left here. You may have to increase it, please. And you can do the CT angiogram. Yep. Just 1 minute is good enough, which I wasted in taking their PowerPoint and still didn't got the pointer. I know, I can see that. Thank you. Then we did a CT angiogram of AVMs in the scalp with a percutaneous injections also at the same time. Okay, this is not working. And post-operatively, we got very good results with this. So in conclusion, if we do all these hybrid procedures, lot of these AVMs can be treated very successfully. You don't get 100% results in the very complex ones, but in most of the places, especially in the limbs, upper limbs, and at the back, but not in the face, because face becomes very complicated because you get a lot of structures, but you can still control the lesions to a point where it's very comfortable for the patients. Thank you.